Have you ever rolled over in bed, looked up at a shelf, or just moved suddenly and you got really dizzy? Well, that may not be a brain problem. What it is, it could be an inner ear issue and could be something called benign positional vertigo. Think of your inner ear as having two jobs. One is to actually help you hear. The other one is just simply to help your balance. Inside this balance system, there are three tiny canals that actually detect rotation when you turn your head. And nearby there are crystals, they're actually calcium carbonate crystals. They detect straight line or where you are in gravity. Unfortunately, what can happen with these crystals, they can become dislodged and move into those tiny fluid-filled canals. And when that happens, they can block some of that fluid. So then you start to get that dizziness feeling when you have motion. The good news is we have a way to help guide those crystals through the canal to help relieve some of those symptoms. And that's exactly what the Epley Maneuver was designed to do. It's not designed to force the crystals through, it just guides it through with specific head movements to help it go through the canal the way it's supposed to. And I want to show you how we do that, but first I want to show you how we test to which side you might be having the issue. That is called a Hallpike test. I want to show you that right here. The Hallpike test helps us determine which ear or which side is involved with the dizziness. It's actually the beginning part of the Epley Maneuver. And we normally hang our head off the edge of a table, off the edge of a bed, off the edge of a couch, something like that. Today we're going to use these pillows to prop this patient up to simulate that head hanging off. But what we start off with is turning the head. We're going to be testing the right side, turn the head to a 45-degree angle, and then we're going to come back and allow that head just to hang off right there. Now, if it's positive, the patient will become dizzy right there. Even the eyes might move just a little bit. That's called nystagmus. That's positive. If the patient is very uncomfortable, you bring them back up. Come on up. You bring them back up and just let them relax there. But that dizziness will be exacerbated because of your doing that. If you're testing the left side, you just turn the head to the left at a 45-degree angle. So that's the Hallpike test. That's the beginning of the Epley Maneuver. Now I'm going to show you the exact protocol of the Epley Maneuver. With the Epley Maneuver, you turn the head at a 45-degree angle. You want to have it so you're positioned so when you come back, you hang your head off a table, a couch, or even the edge of a bed. So I'm going to have you come back, 45-degree angle, come on back. At this point, you may experience that nystagmus, you may experience even increased dizziness. That's exactly what's happening. You're trying to move those crystals through there. You're going to hold this for 30 to 40 seconds. After that 30-40 seconds, you're going to turn your head 45 degrees the other way, continuing to allow that head to hang off. You're going to do that again for 30 to 40 seconds. Then after that, you're going to turn your entire body, laying on that side shoulder, hanging the head at a 40-degree angle, looking that way, 30 to 40 seconds. And then after that, I'm going to have you come up all the way and then look straight ahead. So at this point, you may not be totally relieved of the dizziness. You may still feel that dizziness. You're allowing those crystals to flow through. Don't repeat the steps right afterwards. Allow it to just settle down. So you can do it several times throughout the day, but I wouldn't do it right after the other. What we found at LifeSource Chiropractic, we adjust our patients before we do the Epley Maneuver, and they see significant more improvements than just doing the Epley Maneuver alone. So if you want to see how we can help you here at LifeSource Chiropractic, look us up. But if you're having that benign positional vertigo, this is just a treatment that you could do at home yourself.